So melasma is certainly a very sort of widespread concern that we hear. You know, 1 in every 4th patient has melasma. And it is challenging to treat. We don't cure melasma, which a lot of people don't really like to hear, but we do have several treatment options that really target the reasons, let's say, that melasma develops. So the biggest thing with melasma is avoiding triggers. Triggers being things like sun exposure. We don't obviously avoid pregnancy, but pregnancy and hormonal changes can be a factor. We don't obviously do much about our genetics. But sun exposure and then exposure to sort of ambient light, we can protect against that. So we use sunscreens often with either zinc oxide or titanium dioxide, and even something called iron oxide. So there are many different ingredients in sunscreen that we look for in patients specifically that have melasma to help prevent flares of melasma. We even talk about things like impacting the blue light that's emitted from a screen. So for example, from your computer, from your phone. So we really talk about all the little preventative things. And then we get into treatment options from there, for the most part, starting with skincare. So we can try to turn off the activity of the pigment producing cells with skincare options, as well as remove some of the existing pigment. From there, we would then consider laser treatments for any residual pigmentation that hasn't gone away, with prevention measures and with a skincare routine. So we do have a number of laser treatment options for melasma, the most common of which I would say the most widely known would be the pico laser. So that is a common laser used for melasma, but there certainly are other options.